My name is Heather Klopp Nelson, and I am a manager in IT at Advocate Aurora Health. And you are joining the Chicago Healthcare Tableau user group. We normally meet in person, but this year, as all of us know, we are doing virtual sessions. This is intended to be something that will get recorded and will get posted up on YouTube for later viewing. So you'll be able to share it. So if you're only able to participate for part of the session today, you can go out to YouTube, subscribe to Tableau, and you'll see not only our user group session out there, but many others. And so you might find many other content elements that are going to be helpful to you in your day job. We're going to go through a couple of our conference favorites and just kind of circle in on that. This is an open forum, even though it's a virtual session. So if at any time you have a question or additional comments, if you've got a conference favorite you really want to share or have questions on anything anywhere through this, please don't hesitate to go ahead and speak up. You can also put questions or comments into the chat or Q&A section. We've got some people that are going to help monitor that during our session today and can interject on your behalf. So if unmuting is a little crazy or isn't working for you for whatever reason, the chat session is fine. When we're done with conference favorites, we're going to go turn it over to our partners at Prominence Advisors. They're going to talk about their vaccination tracing dashboard, which of course is very timely. And then my organization, I've got some of my teammates here, we're going to talk about server staging for Tableau self-service. And then we're going to go into some other things that are coming soon, in addition to what we've already got planned for first quarter for our next Tableau user group. So with that, I want to introduce my co-leaders of the user group. I'm going to turn it over to Kelly first and let her introduce herself.
Hello, I'm Kelly Sims. I'm an analyst for the Lake County Health Department and one of the co-leaders of this Chicago Healthcare Tableau user group. And I'll pass it over to Imran.
Hello, everyone. My name is Imran Desai. I work with Rush University Medical Center as a senior clinical analyst from last 3 years. I'm the one of the leader in this group. And welcome, everyone. Hand it over to Heather.
Thank you. So here's a link at the top of this slide, and the slides for all of our presentations will be made available on the community site, which I provide a link to, of course, later at the end, so you'll be able to copy that. But the https tc20.tableau.com/episodes, that'll allow you to search for any of these items in bold. So I will tell you that each of us kind of had our favorites, but data diaries appeared twice. So when we're looking at this list, operationalizing data science, I believe that one came from Imran. A few of us probably were interested in Tableau Roadmap, but that one I jumped on and put out there. Everybody wants to know what's coming, right? Data diaries, I think there were a couple of sessions that were similar to each other depending upon the targeted audience. They may have done that presentation a little differently, but generally governance and self-service. So lots and lots and lots of conversations about that at both the conference and incoming this and coming soon Tableau user group sessions. Row level security tells you a little bit about what it is and how you can set that up. That one thing, row level security, that one thing, and anatomy of a dashboard were from our partners here at Prominence Advisors as some of their organizational favorites. So they might be able to share further insights into that if you have any questions about those sessions. Each one of these little statements is actually from the website. So when you go out to tableau.com episodes, you'll be able to see not just the name, but you'll be able to see a brief description. And it's all, of course, recorded sessions. Some of them were live during the Tableau conference. Some of them were pre-recorded even before the conference and brought forward. So there's a lot of really good content out there. At this time, I'd like to ask, did anybody attend the virtual conference, and did you have a highlight, a favorite, or some really cool thing that you're excited about? Some heads saying no and some silence. That's okay. If you think of something later on while we're going through today's presentations, just feel free to put it in chat or raise it up. We want to make sure that our Tableau user group meets your needs. So you can kind of see the things that this group feels are cool and exciting and are of interest to us, but we're here for you. We want to make sure that this user group meets your needs. So do please share with us the kinds of content that you would like to see. It can be in an email later. It can be something you think of, even the day after Christmas, and you can post it out on community or send us an email. So with that, I think we'll jump right in and get over to that vaccination tracing dashboard. And I believe Austin Montgomery is going to take over sharing. Austin, you're on mute still.
I am double muted. All right, hopefully that fixes things for everyone here. All right, and I am going to take over sharing. So give me just one moment here and we will get started as I tee it up. Okay. Oops, sorry, wrong button. Here we go. All right, so now folks should be seeing my screen. It's a pleasure to be chatting with everyone today. My name is Austin Montgomery. I am the VP of Services here at Prominence Advisors. Prior to starting at Prominence, I spent a handful of years at Epic as an application success owner and reporting lead. And for the past 9 years, I've been with Prominence and focused on helping organizations deploy analytics out to the enterprise. We'll give you just a very quick overview of who we are today so that we have some context of where we're coming from. And then we'll jump into a live demonstration of our vaccine management dashboard and kind of the levels of stratification with which we are approaching, vaccine management analytics. We'll also showcase, I know probably the majority of organizations that are on the phone, use Epic as a primary EHR. We'll also showcase what it looks like to embed Tableau within Epic Hyperspace. You can also embed within Cerner. These are things that we've done as well. So there are a lot of options there, but really want to show how you can make these analytics not only powerful for folks that are consuming them, but also easily actionable and really remove that friction from the workflow as well. So very quickly about us here at Prominence. Our whole goal and whole focus at Prominence is to help healthcare organizations do more with their data. This means getting the right information to the right people at the right time so they can take the correct action or next step necessary and be successful in using that data. Again, the whole goal here is to make healthcare smarter, improve those outcomes, control costs, and increase satisfaction, and retain the great staff that you have today. And we do this by being 100% healthcare focused as an organization. So we only work with healthcare provider organizations, and everyone on our team has that healthcare background. A substantial number of us come from Epic, but the majority of us also have product lead experience and governance experience as well, which is very helpful when you're rolling out and adopting Tableau solutions. Just some examples of customers that we work with. So I noticed that Rush was on the line. We do some work with Rush, so pleasure to see you guys on the phone here. But we have more than 70 customers across the country of all shapes and sizes. So we bring a lot of experience to the table, and these are the folks that we partner with to create the solutions that we're going to see today and make them as relevant as possible for everyone that we partner with. And then from that data perspective, much like Tableau, there isn't a data source that can't be incorporated into your solutions. We've worked with more than 50 different data sources to produce a lot of tremendous Tableau dashboards and pre-built content that really help accelerate your time to value. And we'll showcase a couple of those in just a minute. As an organization, we do bring substantial expertise to our customers that we work with, because we do have that foundational understanding of the operational workflows that populate data into your electronic health records. We're experts at the data transformation and processing capabilities and creating those automated data pipelines from sources to visualization. We have an absolute genius crew of folks who work within Tableau as well, and we'll showcase some of their capabilities in the demonstration in just a minute. And of course, getting that information in the hands of consumers, they've got to be able to trust it. So we do also provide substantial amounts of governance support for organizations as well to make sure that we're raising the literacy level and trust levels of data all around. So slightly different view of the stack before, but where we help organizations is really across the board. So when we typically engage, we'll bring a team of folks to the table to help with any area that there might be a problem, understanding that, as time goes on, needs change and we have to be ready to adapt. So we always have the right resource that we can bring to help with any of the data needs that organizations may have. We'll get into the specifics of some of the accelerators here in just a little bit. But the way that we help organizations, again, that team-based approach of our tech-enabled services, where we leverage our pre-built content to deploy analytics very quickly, save time, use best practices from our 70+ customers, and really get things stood up in short order. One thing that we do like to highlight for organizations and the way that we work, we do focus very much on that governance and reusability of data. So across the bottom of the screen here, we see our data sources that we're drawing from, and these feed up into metrics and dimensions that then move into an executive data model and dashboard that are consumed by our executive team. And it contains metrics, for example, around clinical quality, revenue, and appointments. If our next project was to roll out an ambulatory dashboard, rather than recreate any of that appointments information, we can just use what's already there and bring that into the ambulatory dashboard. This has the benefit of being easily governed because you have one place to go to control how that appointment data is calculated. And then both consumers see the same data points because they're both using the same metric between their visualizations. And this is what really builds the trust for self-service as you continue to deploy out to your organizations. One thing that we do, we do have the pre-built content for all of this that we bring to the table. If you already have a lot of this in your existing data warehouse, that's all right. Our templates and things like that can help complement what you already have. We don't try to reinvent the wheel. But in terms of that pre-built content, here is a list of accelerators that we have, and I know we've got even more out there and available for organizations. So we're continuing to update this slide, but they span the full spectrum of clinical care and revenue cycle, outpatient, quality, academic, everything in between. Tableau is an extremely versatile tool, as everyone knows, and so we like to highlight some of the flexibility and showcase the capabilities of the tool with all of the pre-built content that we have here that can get live in just a matter of weeks. Additionally, and we'll talk about our vaccine management dashboard, we do have a COVID-19 tracking and tracing dashboard that we've made available at no cost to healthcare organizations. You can download that. You can get access to that by reaching out to us as an organization. We'll send you a Tableau workbook, instructions for setup, a metric workbook, so that way you guys have everything you need to stand up a tracking and tracing dashboard at your organization. We originally released this in late March, early April, but it is still something that we're making available for organizations. And also service line reactivation is another accelerator that we're making available for organizations at no cost. It just requires a little bit of time with us to get it stood up for you. But this allows you to reactivate a lot of those services and make sure that you're getting patients back in-house safely, as is a big focus, especially as we start rolling out the vaccine. Okay. And so with that, want to jump into the vaccine management demo and actually walk you through what this looks like from an end user perspective. Afterward, we'll have a little bit of time for Q&A as well. The easiest way, given the number of folks on the call here, would probably be to ask the questions through the chat, and then I'll do my best to answer them as they come up. So with that, I'm going to jump to our vaccine management demo. It's an example of how we combine data from your EHR, your employee health record, population health sources, supply chain, and others to create that comprehensive COVID-19 vaccination analytics. So now, pause here and switch over to our vaccination dashboard. All right. So I have now pulled up our Tableau environment. I'm going to make sure this switches over on the visualizations. It looks like it just went through. So here is our COVID vaccination dashboard. As I mentioned, there are ways to stratify the rollout of a dashboard like this. So I'm going to talk about it kind of in 3 tiers. The first tier and the most important tier for organizations that we're talking to right now is with employee vaccination data, making sure that your frontline workers get the vaccinations that they need, get the first and second dose in that timely manner, and that you have a way to track and manage that compliance is going to be very important. That's, the first piece of the puzzle. The second piece will be managing the patients that you're working with and interacting with on a regular basis to make sure that they are receiving the vaccine and that you're taking the action you need to get the second vaccine doses to them as well. And then lastly, the population health piece. So what we're looking at here, where we're using some of that county and state data to understand what COVID vaccinations are going to look like. So this is taking some of that publicly available information and then combining it with some data that we have about our patients, about our facilities, and we can see on the dashboard, that we can hover over like specific zip codes, for example, to say, our vaccination rates here are perhaps lower than expected, so we can see total vaccinations compared to populations. And we can even pull up some of our facilities to say, all right, well, how many vaccines do we have available? How many appointments do we have? How many unvaccinated staff do we have? And it gives us that executive overview to say, where are we at today? Do we need to move around some inventory? How are we managing our populations as a whole? And what's nice about the vaccination information that's stored within EHRs is it's all a very standard format for the most part, because it's such an important part of the health of the patient, is that you can also use the same sort of layout, the same sort of information for other vaccines. So in this case, we have influenza mapped out here. You can also use this kind of information for pediatric or adolescent vaccine tracking as well. All of those things are possible, but within one dashboard, you can really get that command center for all your vaccines. The next place that I'm going to jump to is actually going to be the employee piece. And so right now, a key focus is making sure that you're getting those frontline workers vaccinated. So here we have our overview for employees who are getting vaccinated, and we can see percentages for the frontline staff that we're tracking overall to see where we're at in terms of making sure our staff are getting vaccinated, especially those frontline folks. And this is where I can basically get that work list of providers who have received a first dose of vaccine, who have not received the first dose, and you can sort and drill into this however you need to, but this gives me that launching point where I can say, okay, well, maybe now what I want to do is send a communication out to this provider to get them scheduled and understand, when we can get them in for that vaccine, or make sure I'm tracking for that second dose as well. Now, I do have, employee MRN and employee name here. Obviously, if that's a level of information that folks shouldn't have access to, you can remove those from a dashboard like this or obfuscate them from certain views. So that way people don't have access to data they shouldn't, but can still get the effective information they need about vaccination rates and how things have been going thus far. Once you have this employee piece kind of taken care of, where you can understand where your employees are at in their vaccination process and make sure that you have enough vaccines to manage them, you can then start moving into caring for patients. And so here we have an example unit where we borrowed this from our discharge planning dashboard. And instead of focusing solely on managing capacity and discharges, we've also included in this custom geo a warning sign to say that the patient hasn't had the COVID vaccine yet. and we should take care of that before the patient leaves or is discharged to make sure that we're doing everything we can to vaccinate the population as a whole. This does require a little bit more real-time information out of the EHR. There are a handful of ways to do that we've done with organizations. If you want to talk more about what's possible there, we'd be happy to do that offline. It's probably a little too detailed for conversation today, but this does rely on data getting updated, every 15 minutes or even more frequently in some cases to make sure that people looking at a dashboard like this always have the most accurate information for what's happening on their floor. And then the last thing that I'm going to call out is our Actions tab. And this is where we condense some of this information into more actionable insights that we can directly act upon. And so, for example, we can pull in that time and attendance data for our staff and find upcoming shifts where we have a large number of unvaccinated staff. And so we can see the next oncology shift starting at 7 a.m. has 8 unvaccinated staff. We could potentially link out to our Infor ERP system. This is just an example, but could link out to this and perhaps schedule a mobile vaccination cart to go to the unit. That way those providers don't have to worry about checking in somewhere, getting to a place where we have the vaccines, we can bring it to them. Additionally, for patients that might be approaching or past due on their second dose, we can jump into the EHR in a moment, and we'll show what this looks like as well. For people who are following up on the patients who receive those vaccines, we'll show what this looks like directly within the EHR, but we can embed this into a scheduling workflow. And of course, vaccine side effects, outcomes, adverse reactions, those can also be cataloged and shown on a dashboard here as well. So we like to highlight that, this is where we can find those populations or perhaps groups of folks that, are not responding as well as we'd hope to the vaccine for one reason or another. But based on the news so far, it sounds like the providers that have been vaccinated are doing very well. And I think I've only heard of one adverse reaction so far, which is incredible. So hopefully there's not a lot that goes into here, but again, just a good example of some of the things that are possible. And you can also use this to track reactions to other vaccines as well. So what I'm going to do next is just kind of showcase. It looks like that the demo to show exactly what it looks like embedded into like a workflow like Epic is not available for me, so I won't be able to showcase that one on the demonstration here. But the way that you can picture it is this Tableau dashboard would be embedded directly within a Radar component, so it would be a starting tab for a provider or a scheduler working within Epic. They'd access exact same visualizations, of course, only have access to the data that they should, but then when they click on the scheduling button, it would just pop open that patient's chart into a scheduling workflow to get that patient scheduled for their next vaccine. So that's definitely an integration that we've done with a handful of organizations. If you're interested in setting that up, we'd be happy to do that as well. But this is the vaccine dashboard overview that we've created. We're making this accelerator available for free to organizations. We're also making our platform, which has pre-built content underneath it, available for free to organizations. And to get this stood up quickly, we're even including free hours to help get this live for organizations that need it in a very, very quick time frame. So if that's something that you're interested in, we'd be happy to dive a little deeper into that with you. Perhaps a sidebar conversation would be appropriate for that. But I'll pause now, see if there are any questions folks might have or want to share our way. If you are interested in seeing how you can get the vaccine accelerator, please reach out to Hunter, my counterpart. His information is listed here. He'd be happy to get some time scheduled as well. And then I realize the link on the right kind of blends into the gray background. I apologize for that. We do also have a couple upcoming webinars in January. For UCSF, we'll be presenting on financial KPI work that we've done with them in Tableau. And then we'll also be participating in the Tableau Pulse, covering how to maximize your revenue opportunity using HCCs to improve, your risk adjustment factors and scores like that. Make sure you're staying on top of those value-based payments that organizations are aligning more and more toward. So you can register for those. It's just providenceadvisors.com/webinars. And we'll get you taken care of and registered for both. But for now, I will pause and see if there are any questions. And I will give it the requisite 10 to 15 seconds here. I know we're remote, and so a little pause is required. But if you do have any questions, feel free to throw them in the chat. If you have no questions at this point in time, hopefully, what we showed you was valuable, gives you some ideas, shows you what's possible with the information that everyone's collecting and working through today. And if you do have any questions, again, don't hesitate to reach out or connect with Hunter. And hopefully we'll see a lot of you guys at our upcoming webinars. Thanks so much for the time today. Heather, I'll pass it back over to you.
Thank you, Austin. I have a couple questions myself. I'm wondering whether or not a user can just go out to your website and download it, or do they need to reach out to you or Hunter?
To get a copy of the vaccine accelerator, they will need to reach out to us. That's a very good question. The COVID tracking and tracing dashboard, also reach out to us on that one. That one's much more of a prepackaged thing because the data that it leverages is more standard than a lot of the vaccine and employee information. A lot of employee health records are pretty niche systems. And so the tracking and tracing one, because it relies on like lab results and appointments and really pretty standard structured data elements, we can actually get that one to folks just over an email basically. So if you're interested in that, we can deploy that one very quickly. But for the vaccine tracking one, we do have to have a conversation about how we set that up with you guys.
And in our world at Advocate Aurora, we've got more than one system that would go into your vaccination tracker. So we've got, employee health. We have 2 employee health systems, one in Illinois, one in Wisconsin. And then we have Epic, which is almost live for everybody, if not live from a hospital perspective. Is there any distinction in your workbook as to whether or not that's at a hospital level or at an ambulatory setting or inpatient, outpatient? And if it was visually represented, I missed it. So just wondering if you flag any of that differently.
And I'm sorry, it cut out just a little bit at the start of the question. What is it that you're wondering if you flag a little differently?
If you flag inpatient versus outpatient setting, you showed the hospital patient rooms where there's not a COVID patient or not a patient with a COVID vaccination. Do you have anything that represents those ambulatory patients?
So that would be a little bit different approach. It'd be much more like a work list to say, hey, here are the appointments that we've had or the encounters that we have. Here are the patients that are coming in that don't have the vaccine. So it would be probably a little bit more table-based in its visualization in terms of where those patients were coming in and going to. But absolutely, you can flag inpatient versus ambulatory populations to say, who are we working with today? Who's coming into the clinic today? Who needs a vaccination? Who's eligible for that vaccine based on, initially it'll start by things like, probably like age group that they're in. So do they qualify for this, maybe the second round of doses of vaccines that come out? All those sorts of things can be used as flags. I didn't have it built as a visualization in our example dashboard. So that's a good example of something that we can add on to make it a little bit more robust, but definitely possible to put in there and would be pretty easy from a work effort standpoint because you're getting most of that data already. You're really just needing to pull in some appointment information and that's it.
Okay, sounds great. Any other questions?
I have a quick question. So this is more, you design the backend data on a Clarity or Caboodle, and another question was what employee data you are using, and is there any application you keep in mind to collect those employee data?
Yeah, so the first part of that, the Clarity and Caboodle piece, we work on top of either data source. It really depends on kind of what you consider to be more of that source of truth. If you have a good data set in Caboodle, it's validated, you're comfortable with it, can absolutely pull from that. It's usually easier for a good number of elements, data elements, just because it's a more it's more structured for reporting than Clarity is itself. That said, we know organizations don't all have Caboodle or don't all have it stood up yet, so we can work off of Clarity as well. It's not an issue to do so. In terms of the employee health record systems, we've run across a couple dozen of them. So unfortunately, we haven't found one that's kind of a standard. But as long as they allow, regular kind of standard database connections, the ODBC, the JDBC type connections, relatively speaking, it's easy to get that data out. It's just a matter of saying, all right, where do these data elements live? Are we making sure we're interpreting them correctly, based on how the documentation is input? So that way, everything just comes out correctly in the end. And that's where we do testing and validation with our customers to make sure it's as accurate as it can be.
So do you provide those documentation with the format of the Tableau? Like what kind of employee data we need to get and what kind of filters we need to put?
So yes, we can provide a starting point for that, but not the extremely technical, detailed information. So for example, we'll obviously need to be able to pull out, all of the employee record information. But then if they have, if you have in there also like a title for the provider or, their clinical role, that would be something else that we'd probably need you guys to tell us exactly where that lives in the data source. So that way we pull that out, but that allows you to stratify your providers by, clinician, mid-level, nurse, whatever it might be, and get to more granular levels of detail. And so that's where we need some of that assistance from you. Another example would be, where are you documenting the administration of the vaccine? It's likely either within something akin to the medication administration record that lives within there, or there's usually a separate immunizations activity because, again, immunizations are a pretty standard workflow in general. And then how are you denoting the first and second dose, just making sure that we're pulling all the right things. So we can tell you the things that we need, but we can't exactly say, where each individual element lives, or if we're interpreting it perfectly correctly. That's where we need some technical expertise from the customer team.
Fair enough. Thank you very much.
Absolutely. All right.
Any other questions?
All right. Well, thank you so much for letting us join in. Hopefully, again, it was valuable, and hopefully everyone has a great rest of the day here at the Tableau user group.
Thank you, Austin, and others at Prominence Advisors who are on the call. Again, just put some comments in chat where needed. They are going to stay on for the duration of the session. So next, we're going to go into the self-service idea with Tableau, and self-service means a lot of different things to people. So I'm going to define that. But before I get started, feel free to take note of our email addresses, first name dot last name. Mine's got the hyphen in it, all complicated and stuff. But Mike and G are going to talk to kind of that server side, I'll say stuff, the admin things. I'm going to talk more towards the planning and the staging, kind of why we did what we did, and go through it from an SBAR perspective. What was our situation and a little bit of background, and then, what were our recommendations and how did we get there? And I'm going to give you some lessons learned. I actually got 2 slides on that at least. So we learned a few things in the process, and of course we are still learning. Interrupt me at any point. I am going to be looking at PowerPoint. I am going to be looking at the camera, and way over here to my right is where the questions are going to come up, maybe on the chat. So feel free to verbally interrupt me because I might not see something pop up in the chat right away. 3 monitors and all that. Jumping right in, self-service definition. An individual or a team of creators or explorers who are also creating content who are going to need minimal support. So they're creating content, they're publishing that content. That content could be a data extract that they've created themselves from their own data set, or it could be that they're creating a workbook, either off of that data set or off of a data set provided by another team like IT. And then they're going to be sharing that content. So self-service customers in our environment also have the ability to set security permissions to a certain degree. We've given them some tools and put some controls around that. So we're going to talk a little bit about how we did that at Advocate Aurora. So here was our situation. You may be aware of this, that a few years ago, Aurora Healthcare in Wisconsin and Advocate Healthcare in Illinois merged to become Advocate Aurora Healthcare. Before we merged, and even for the first couple of years afterwards, we had separate license agreements that we held with many of our vendors, and Tableau was one of them. But separate license agreements mean separate customer portals, separate servers, lots of different versions, depending upon where there were standards and where there weren't. In Wisconsin, we found that they had a test and a production server, and those servers were, I would say, lightly used in comparison to what we had. But in terms of the number of creators, they had about the same number of desktop users, folks creating content locally and maybe published it, maybe didn't publish it. In Illinois, we had at Advocate Healthcare, we had 2 production servers. We were going into this with a customer build server, which was basically where our self-service customers were targeted to use. So they could have that as their sandbox, their development and testing environment. We did user acceptance testing in that environment. So even some of our just interactor users would go over to the customer build server to do their user acceptance testing. And then they would flip over to our production server. Well, as you can imagine, that as we grew, that became very confusing. We had nurse leaders who were trying to test things on customer build. We'd give them the link, and then we would tell them, now you have to go to another server to use this on a regular ongoing basis as a production product. And they're scratching their head about why are they using 2 different servers. Some of our self-service customers came in and they were like, oh yeah, we've got this customer build environment for you to build your own work and play with it and test it. And then you can move it over to production. You know, why would they do that? Why not just work in their playground space on production? And then because we gave them permission to assign security, go ahead then, and when they're ready, share it. From their perspective, not managing the server side of things, why did they need to bother with 2 servers? They had one place. We also evolved into this other hybrid where we had some explorers who were not creating content, but just needed to do some kind of ad hoc analysis, not anything they needed to save, but they needed to do that off of content that was only on production, not on customer build. And then we had vice versa. So it was getting kind of confusing, in case you're not following that part. So we needed to do an assessment. We needed to bring the organization together as part of our HIT initiatives, were to, align our contracts with our vendors, centralize things as much as possible, and centralize standardization, across the organization. So long story short, Wisconsin had about 60 desktop licenses, but they were all pre-subscription license models. So they were on like version 9 dot something or 10 dot something as recently as January of this year. So they had some pretty old licenses and they were fine. It was working for them. They weren't trying to publish to the server. For those of you who might not have been with Tableau that long, back before we had subscription model, when you purchased a desktop license, you also had to purchase a license to get on the server called an interactor license. So that meant that in Wisconsin, we had people who only held a desktop license, maybe did not have rights or a license to log on to the server. Now with the creator license, that comes with server access. So we first had to get all 60 plus of these users lined up to be on a subscription license model. There was not a standardization because they were all kind of little pockets of analyst and development teams. So they worked with what they needed, upgraded when they needed it. The license renewal was handled at IT business office, so that made it easy for them to just, upgrade when they needed it. There's also, a lot of limited sharing that was going on. They would share from desktop to Tableau reader, and they would share from desktop user to desktop user. So I found some teams that they might have held like 10 desktop licenses amongst their team, but there were 2 creators and they used desktop like reader. Not sure why, that's just the method that they did. I think because there wasn't a centralized support group that really understood, how to position Tableau desktop and Tableau server. So we came in with some concerns. If we're going to put all of these people, and I know 60 doesn't sound like a lot, but that is a lot if they're all on at the same time on our server with our existing customer base, that could be a lot of intensity on our server. And so we were kind of concerned. We didn't have a staged environment that would support load balancing, for example. We had a single node server. We had limited failover support in Illinois, and we discovered there was no failover support in Wisconsin. And then, of course, that heavy server interaction, when you put all the explorers on the same server and you give all these creators the ability to publish their work in Sandbox on a single server, which was our intention. So that was kind of our assessment. We had a few challenges. The recommendation we submitted is here. This is what got approved. We would go to a multi-node cluster server configuration. That would give us the ability to have better load balancing and failover capabilities, to which G will describe and Mike will describe much better than I could. So those are my bullet items. We upgraded all users to 2020.2. At the time earlier this year, that was the version that was the latest version. And so we upgraded everyone to 2020.2. We also, of course, before we could do that, we had to get all the license changes in place. And that meant one license agreement. So that involved legal, it involved Tableau, and involved a lot more people in IT than I thought were there in IT in the business office area. So I learned a lot about that process. We're down to one customer portal, which is great because that was really confusing trying to go to what started off as 2 became 3. And once the confusion was done, we landed on 1. So that's great. We converted all of those users to subscription model. So we've had a little confusion with that. Sometimes people have the old license key that starts with a TD for Tableau desktop. And if they upgrade, that TD license key doesn't work. So they should be using the TC license key. Well, the TC for Tableau creator license key, some people tried to plug that into the old desktop version and they're wondering why it doesn't work. And I've taken a few support calls on that. I suppose I'm jumping ahead to my lessons learned, but it goes to that license key at the desktop level is a bit of a challenge to maintain. And 2020.2 introduced the new feature of being able to log into the Tableau server and register your license on the Tableau server. We have not yet implemented that, but oh my gosh, we are going to be testing that soon because that level of license management to that level of detail is kind of challenging. And then we had to present our Tableau self-service model to our Wisconsin customers. They never heard of us before. They had had some support for a Tableau server. Some areas didn't even know there was a Tableau server available. And so now we've got all these people who are in front of us and saying, yeah, they use Tableau, they need that license key, they need help getting upgraded. But then, hey, did you know your new license key also allows you to access the server? Did you know you can publish content on the server? So we did a lot of training sessions, usually team specific, but sometimes we had little analyst here, analyst there, and we would consolidate those together. But because there's so much customized needs, and we wanted to learn what these folks were doing with Tableau, what data they were working with, how they were sharing that content now, and be able to guide them and advise them to better ways to do that using the server. So we met with each team individually. I'm going to turn it over to G and Mike and let them kind of speak to the next few slides so that you can understand the hardware and software component of our environment. G.
Thank you, Heather. Hi, everyone. My name is Gerlu Mekon. I'm a Tableau server admin. And in this short presentation, I'll be showing you some of the steps that we have taken regarding our Tableau server environment, where we have been and where exactly we are at now. So on this slide, like the slide you are right now seeing, we have different set of servers over here, all in a standalone machine, right? It looks so beautiful over here, but trust me, from managing point of view or from admin, that's one of the pain points that we have experienced. But this was what it used to be like a year or something ago. So on this platform, on this environment, which we used to have, we have 3 servers from Illinois side and 1 server from Wisconsin. All the Illinois side servers were on Tableau server 2019.3, and we have the Wisconsin server was something older version. On giving you a little bit of understanding about what Illinois versions are and what exactly they do and in what form they're configured, let me start from the leftmost part of the server, which is a dev environment, which is a development Tableau server, which we use it as completely as an IT sandbox for new features and testing. It is a testing playground for us as well. And we do launch and learn kind of activities as well. And the other part that we have on this server environment is customer build. As Heather said earlier today, this presentation, the customer build server is dedicated to, it contains all kinds of data extracts which are created and maintained by our department. And also it gives the privilege for self-service content owners to create and publish their own data extract and workbooks as well. And it is also a UAT environment. And the third server within the Illinois environment is the production server, Tableau production server. It contains all kinds of production level data extracts and workbooks, which are created and maintained by our core BI team. And also it gives the privilege for self-service customers as well to produce and publish their own contents if they have any. And on production, we also have all the contents over this production level server are up to the best industry practice. We apply we typically create like top level projects and create different user groups and grant appropriate permissions for our Tableau users. Besides that, we do the maintenance part and we take care of all kinds of data which is presented within this within this production server. One thing about this production server was, like I said, it is open for self-service customers, but as you know, all privilege comes with some kind of responsibility. So we give a huge amount of responsibility for self-service customers to maintain their own data extracts or data source and their workbooks which they publish. One more thing probably worth to mention on production, what we do on production server, like I said, is we create user groups and grant permissions, right? So we have this homegrown application called Tobas, which does the job for us, and we give the appropriate training and we give the appropriate permission for self-service customers to use Tobas. We encourage them to use Tobas to whenever they want to add users in their user group. Next slide, please, Heather.
There we go.
There we go. Over here, we can see that the customer build compared to the previous slide that we saw, where the customer build and production server and the Wisconsin server were ad hoc servers. In this part of our journey in our environment, what we did is we merged our customer build server and we merged our Wisconsin server to one big production server. So why, we might ask, why do we need to merge? I can spot out like 3-4 points. The first one is it is much easier to maintain. And the other one is it eliminates duplicates. One of the problems in having when working on data or when working with a huge amount of data sets over here and there, one of the pain points in big organizations is having duplicate of data, duplicate of users, permissions, and whatsoever. So in unifying those customer build and Wisconsin servers into one big production server, it eliminates that problem for us. And the production server is in this new environment, the production server, besides being as a production, as Heather said it before, we also grant our self-service people to use it as a dev/test environment where they can bring on their contents and they can, they can run it, they can test it, and finally they can migrate it within the same server. Actually, they can finally produce it as a final publication, or they can publish it on our production servers. So everything you see here is the good approach that we have been. It is an intermediate environment, meaning that the previous one was like, we have a standalone servers spread over the two organizations. Over here, we consolidate the servers. And the third part, we will be discussing about the next step that we did in our project. Next slide, Heather. All right, over here. So the environment is consolidated on production server, but we see a couple of nodes over here. Obviously, this was one of the good achievement. I would say one of the big achievement that we did when it comes to evolving our server through time. So what we did is we introduced, we clustered the production environment, which consists of basically three nodes. As you can see from here, we have node 1, node 2, and node 3. Basically, you can take like node 1 to be the merged production server that you saw on the earlier slide. So node 2 and node 3 are a new brand servers where we configure to be part of the multi-server environment. So right now, our configuration is what we have is just a clustered environment which acts like a single unit. This cluster environment is made of 3 servers, and it has basically it has like tons of advantage to go for clustering. Maybe the next slide will present a good understanding about why we clustered and what is the advantage. Okay, thanks, Heather, again. So the beauty of clustering over here, we can see that once you cluster, you have a better high availability and you have a better redundancy. When it comes to redundancy, it might be file redundancy. It can be any kind of the process that you run within Tableau server. It might be the cache server or the backgrounder or the data server, the data engine, whatever service you run on Tableau server is technically redundant, technically duplicated because of this multi-server system or due to this clustering. So that was one of the biggest advantages that we have. And the other one is you can even cluster or you can even replicate the repository. As a basic understanding, everything you do on Tableau server is going to be stored on a backend repository, right? So on clustering, what exactly you're doing is you're going to have copy of that repository as well. It can be in active and passive mode, and that's something that's very much important when it comes to when it comes to redundancy, or when it comes to what if one of the repositories down, can I still be available? Yes, you can be, because of thanks to the clustering configuration. And that's a basic thing that we do is we introduced a load balancer. Technically, what it does is it has a gateway, and it will continuously it will check which of the servers within the cluster are available, and it will reroute all the requests to the available server. So one good use case scenario that we had a couple of days ago, where if you see on the right side of yeah, exactly, that's where I'm talking about, the right side of the slide, you can see set of process. Those processes are list of processes which are running on a Tableau server, and we have node 1, node 2, and node 3. Those are, like I said, those are part of the cluster or multi-server system, right? So under the process, you can see that duplicates of process are running on node 1, node 2, and node 3 because of, like I said, because of the multi-server system. So the good example over here is, let's jump to search and browse process. Yep, that process. We can see that two of that process, the search and browse process, is okay, up and running, but the one on node 2 is failed. So let's forget about clustering for a time being. Let's assume that this node 1, node 2, and node 3 are independent servers. So in this scenario where search and browse service is technically down on node 2, what it technically means is, if you try to sign into node 2, you are okay, you can sign into node 2. But if you try to see the contents of a workbook, contents are invisible because of the search and browse services down. That doesn't mean that the contents are purged or eliminated or dropped, but it means that the search and browse service is not up and running, and it's not giving you back the right result. So in that case, if on a standalone environment, if a service like search and browse is down, technically you cannot see anything within a workbook. But lucky that this service is distributed across our cluster, even the user without knowing it, he or she is not going to face any kind of problem, because the service is duplicated on different servers. And when a person logs into the Tableau server, the person doesn't know where exactly logging to. It might be to node 1, node 2, or node 3. So even if you are, for example, you are logged into node 2, it will automatically reroute you to the server which has running search and service process. So technically, you're not going to face anything. You're not going to feel anything about whether that service is down or not. You're going to see, you are able to sign in, and you are able to see all the contents in a workbook. So this is a good use case scenario when it comes to redundancy of service and redundancy of process in your platform. Next. All right. So all in all, the project steps, like this at this point, we already knew that we have already merged our servers, the first thing, and the other thing, we have already done the cluster. And like Heather said, when we do the cluster, the servers were on 2019.3. So the next step at the beginning of this year was like, okay, 2020.2 was the very new thing back then. It got like tons of new features, and we were always looking forward to that version, and we found out that this was the right time for us to get upgraded. But the difference on this part is we are upgrading a cluster. We're not upgrading a single server. So pretty much the idea is going to be the same, but the steps which you are going to follow when you upgrade a cluster versus a single server is a little bit different. But part of our project was doing that. So we after applying the cluster, we upgraded to 2020.2, and we did the testing. We did a lot of testing when it comes to the look and feel, the publishing experience, and the workbook, refreshing extract, and tons of things. We and our self-service customers tested everything on our development machine, on our development environment. And finally, when we got certified that everything looks okay, or everything meets our expectation, we then applied all the changes to the cluster that we have on production. So as of now, our production environment is on Tableau Server 2020.2, and and it is we're glad that we're glad that we are on current version, and we're glad that we are looking forward to get a new upgrade whenever Tableau releases, and we feel like that is the right thing to do. So thank you so much. We will for sure on the Q&A part, I think you might have few questions so that we can get the opportunity to answer those questions on that part. I'll pass it to Mike. Thanks, Heather.
Hi, everyone. This is Mike. Hope you can hear me okay. Yeah, so I'm just going to pick up on this slide here with regard to our project steps. So these two pieces, the cluster and upgrade, as well as the consolidation, were happening somewhat concurrently. But down at the bottom of the slide, I'm going to just walk through the consolidation effort. What we did for Illinois is we moved all of the content from our customer build server over to this production server. And so there's 61 objects were migrated, mostly data sources, but 15 workbooks as well. And then for Wisconsin, what we did, and Heather sort of talked on this a little bit earlier, we consolidated the licenses, subscription renewals. We updated our contract so that it was the larger entity, not separate, separate entities. And as a result, we obviously had a lot more volume onto this, or user volume onto this production server. And then lastly, we really, I engaged for the most part, like, the user community. Heather mentioned this earlier. We were discussing sort of, our standards to each area. And these standards include, things that are not just, sort of aesthetic standards. We wanted to kind of make sure that there was some sort of uniform look and feel, but really also how we were going to be handling content on the server, and so forth, which I'll touch on in the next slide. Okay, so the way we set up our self-service model is similar across the enterprise. So highlighting off on the right, one of our customers is internal audit. What we did is we definitely made sure to use, and I know Heather will talk on this a little bit more later, but we wanted to use user groups, the names of the user groups that were sort of consistent and in alignment with license type for the most part. That definitely helped us out considerably as we were setting up permissions and whatnot on the server. What we did is each user area would have a top level project, and then we created nested projects for, one was exclusive for data sources, and one was also like a sandbox for the development and testing work by the group. We had the creators, and publishers were trained a little bit differently, right? The creators needed to understand how to publish to the server, both workbooks and data sources, and where they were going to put them. And then the publishers, they were going to, there was only one or two per business area, and we were allowing them to publish to the top level project, and basically move content from the dev test environment to the top level project, which we would consider the production ready material. And then G mentioned earlier that we have an application called Tobias that we would also train our customers with, so that they could kind of provision and manage users on Tableau through a self-service application. So that was our setup. I think next slide. So this starts what we learned, and I know Heather mentioned that we did learn a lot. We certainly did. I'm just going to just touch on a few things here. As we walked through this project, it was really, really helpful to have, this sort of, Gantt chart that we put together to monitor the steps in the process. I mean, whenever we start a project, we want to adhere to a project plan, no matter how small, right? And if one of the things we learned is that if there's more than 3 steps, or more than one person involved, we definitely document and hold regular meetings on what we're going to be doing. Really, though, just sort of in a more general sense, in 2020, given COVID, it's we had to really be flexible and be ready for anything, like this slide says. We did increase the volume considerably, and as well as the teams on the servers. So it was important to engage our user community, make sure that and train them to make sure that they knew where to find information, as well as who to contact. And so building those relationships was really, really important. And they knew where to come, right, for help. And the other thing, is obviously solid vendor relationships. Heather mentioned this earlier. We had a good foundation to work with, and to maintain those relationships to get all of this in line. But that was most of my slide here, Heather.
Thank you, Mike. I'm going to move to the next set of lessons learned. As soon as my slide deck will let me move. There we go. So some additional self-service standardization elements. Getting everybody onto the same license model was really key, because if you're on different versions, if you've got a mix of the older license model, whether that's enterprise or named before subscription, after subscription, that was messy, is probably the best way to say that. So it's appropriate to first kind of figure out what the best license versions are. You've got the creator, the explorer, the viewer, and then what kind of permissions do people need? What kind of server access are they going to need? If I was implementing today from scratch, I would probably meet with these teams as a collective group, all of my self-service customers, get them all together as much as possible, and talk about the options and the features and what limitations there are with viewer, what limitations there are with explorer, what can you do with creator, but what won't we allow you to do on the server. One of the things that we decided not to do was we decided not to roll all of these self-service customers out with their own site. So for those of you who might know Tableau Server Administration, you have the ability to create a site on the Tableau server. And that gives, let's say you want to create a site for HR, or a site for nurse administration, or a site for physicians. Those different areas would then log into their site and only see the content. You could then give a site administrator role to someone who's going to manage that. That is a self-service option that we opted not to go with, because the majority of customers coming to consume content and regularly interact with content want to log on to one place and go from folder to folder to folder. They would not want to log off of one site to log on to another sitting on the same server. We felt that would be a user deterrent. So we felt it was better to, and we may change our mind, but for right now, this is where we're at, that we are going to have everybody logging onto the same site, just that default site, and we will control things at the project level. So that's a big reason why we went to the top level project and then have nested projects within, as one of the previous slides mentioned. So that was a big element, that when you set up those different user, or those different projects, those different folders, that ends up creating some security challenges. So you have to make sure that you understand that model. So that model of putting a user into a group, giving the group access to the project, the top level project, and then whether you lock it in there or you give that user's group access to a nested project. And with the later versions here, you can lock it that nested project. so that any additional projects below can inherit that, as well as any content. But one of the big challenges there is really understanding what all of those checkboxes mean across the permissions information. Because if you don't understand, what all those nuances are in partnership with what their license allows them to do, then you could end up giving somebody access or think you're giving somebody access, but they don't actually get it. So for example, if you give someone with a viewer license access to download the full data detail, you think you're giving them that ability, but they don't. Their license prevents them from downloading that full data set. So it's a combination of license and permission settings. So I created a little cheat sheet for myself to help with some of these things, and I'll show that in just a second. The primary thing to realize is that when you create those user groups and you give those permissions, it's a combination of what content access rules do you want to give, plus the license that the person holds, the user holds that license, and then the site role and those permission settings for each type, permission settings at the project, the workbook, the data source, and all of the other elements. So once you kind of standardize on what that's going to look like, then you can do exception handling, and you just have to document that really well. But when you standardize on those permission settings, it makes it easier to implement policies and procedures to maintain that, and then you have to audit that. And one of the things that Mike did a really good job on with our standardization documentation was he identified these are absolutely mandatory required things. In other words, this is what we're going to audit, and if you need to be on a naughty list, we'll put you on a naughty list. And if you go on the nice list, that's awesome. We will audit again next quarter. So we've got to monitor those kinds of things. So there's a short list, I think, of required standards. And then here's a whole bunch of other things we consider recommendations that we would like our self-service customers to do or to consider, but they can deviate from a little bit if they need to for their project work. And here is my cheat sheet. Obviously not a full cheat sheet. It's not the full picture of all the permissions that can be assigned, but here's the core license types. And for those of you who aren't server admins, if you have a viewer license, you set up a user. Let's say John Smith is a viewer, and John Smith should have a site role called viewer. If John Smith actually has legally a license that is a viewer license, but you set him up as an explorer or a creator site role, then that's breaking your numbers. You're not going to sync up with customer portal, and things are going to get wonky for you pretty quick. That's my technical term for today. So you've got a viewer license with a viewer site role, and there's some very basic things they're allowed to do. Lots and lots of really cool stuff, but there are some things that they can't do. So even at a workbook level, if you check them to be allowing them to download that full data set, they can't. If you check the box to allow them to web edit, they can't. So is there any harm or foul to that? Maybe, maybe not. We try very hard to make sure that the viewer licensed user with the viewer site role is in a user group with the name viewer in it, and that we appropriately check the right boxes, because we've had more than once where a user has upgraded from a viewer to an explorer, and if they have that viewer user group, let's say they're in a finance, and then they're in a payroll, and then they're in 3 other different user groups. If in payroll, they're not supposed to be allowed to download that data set, but they get into, that Explorer, and if we've checked that box, even if they're in a viewer user group, but now their site role changes to Explorer, guess what? Now they can download it. So we have found that if we tie the name of the user group to the site role and the license, that just simplifies things dramatically so that we know exactly what permissions we're setting across the row. The other little gotcha here is that if you're an owner of content, meaning you have gone with your workbook or your data set and you've published that up to production, even if it's in a dev test project, nested project, you publish that content up. Then if your team's dedicated publisher who's allowed to migrate that to production, a production folder to share with the masses, what happens if you move that, if the publisher moves that, it does not change the owner. So if John Smith has become a creator, he's published content up to the dev test nested project, but he's not a production publisher. If he publishes that to that nested project, and then the publisher, say Mike Passon, then takes that and moves it, well, John Smith is still the owner because he didn't republish that document. Mike didn't republish that document. So if Mike does republish that, I keep saying document, I mean workbook. If Mike republishes that workbook, then Mike becomes the owner. And it doesn't mean John Smith can't download that workbook. It doesn't mean John Smith can't take that workbook and do something else with it. It just means that John Smith can't delete it because he's no longer the owner. He can't change permission settings because he's no longer the owner. But if we were to simply move from that nested project to the parent top level project and gave the world access to it that's supposed to have it at the top level project, then John Smith would still have control over that workbook, whether that's an accidental deletion or not, whether he web edits and changes something that doesn't go through all of the proper protocol of internal QA, user acceptance testing, and approvals to go to production. These are things that you want to be able to control. So we learned pretty quickly that we have to teach folks, don't move, migrate, because there's other things that can happen. If that owner of that content transfers to another department and they still have Tableau licenses, that can cause some entertaining challenges too. So you gotta be real careful on it. Highly recommend that you dedicate some publishers to your production areas and that you truly do a full action of publish and not a move from folder to folder or project to project. So that was kind of our lessons learned. Just thought that we would share this last bit with you that when we did do the upgrade, we upgraded in our environment in Illinois, we upgraded like skipped three different versions. So this is a document that we shared with our customers in Illinois. Wisconsin kind of upgraded from a variety of even older versions. So we didn't go back too far, but we went back the three versions. Notice there's a pattern on these hyperlinks, so that might help you going forward if you're in a state where you might need to upgrade. It's kind of a little cheat sheet for now. I can't say, of course, whether Tableau will continue with that pattern, but it was definitely helpful for us in our last upgrade. And we're at the Q&A time, so what you got? Looks like there's something in chat. How many server administrators does your health system have? Well, in terms of Tableau, we have 2 server administrators, and I get to do a little bit of show and tell there. I help out a little bit, but we have 2. We have G and we have Mike, and G's focus is truly on the server side. He did a phenomenal job with that cluster and the actual task of upgrading. Mike is more that power user site administrator kind of thing, but at the default site level. And we've got a programmer who helps out with that Tobias application that we mentioned. So they work closely together, and myself and my director. Does that answer your question, Crystal?
It does, thank you.
Sure. Other questions?
Hey, Heather, Imran here. So when you merged with the Wisconsin, how did you merge their server data or whatever the workgroups and data source they publish into their server to your production server? Did you
Sure,
do
sure.
them
Mike, do you want to
manually
field
or?
that?
So the question was, how did we merge the Wisconsin data?
Yes,
Yeah,
content of all types.
yeah, we didn't have, we actually staged them on the new server for the most part. You know, there wasn't a lot, keep me honest here, Heather, of content that we brought over from Wisconsin or directly, right? It was mostly setting them up with our, you know, our sort of schema, right, on the server with how we were handling all of our customers, training them in that regard. And then, you know, walking them through publishing and how what they need to do, you know, and I created a bunch of documentation that I think everyone has told me has been really helpful. So, but then, you know, literally taking an hour and walking them through publishing both data sources and workbooks and how the, you know, how the permissions are set up on the server, who's got different permissions, you know, and all of that is, you know, is really invaluable. And that you are establishing trust with them, you know, and they know where to turn when they have questions and so forth.
We gave them the choice of migrating their own content by downloading it to their local creator and then putting it up on the new server, or that we could do that for them. And it ended up being a mix, depending upon people's, you know, time availability and skill set. It was during COVID that we were doing this, so we definitely volunteered to help as much as people needed it. And some people took it up and other people wanted to do it themselves and used Mike's training to, you know, to learn how to do that. And they looked at it as a first opportunity to understand how to make it work.
That makes sense. Thanks, Heather.
Mhm.
And I like your, sorry.
Okay, I'm sorry, Imran. If that was our experience, but that doesn't mean it is the only way to migrate contents. The reason why we followed what we did is because we didn't wish to buy Tableau management add-on, which has a part in it to move contents and things like that. So that's another option, just to give you a highlight about the product is there, and that's another option as well.
Right. That makes sense if you have another server which has so much data. But since the Wisconsin, they are not using much, it's better to do it manually and ask them to do. And I really like your idea about creating a user group with their roles like creator or viewers or explorer. And regarding those sites, in my experience, that makes sense to do when you have like test or production. Like you can create another site when you like to have test and production, and another site for production. For as you said, for like physicians or nurse, it would be better to do the folder project wise category. But if you have something like production or test, it makes sense to create a different sites. And I don't think you need to log in differently. Once you log in, you just need to switch the site without it won't ask you to re-log in. So this is something you can look into.
Thank you.
Thank you.
Other questions? Okay, so a big thank you from Advocate Aurora Health. We wish you happy holidays. And I am gonna go back into our main, at least I'm gonna try to, presentation here. And here's what's coming next. So if you're not already receiving the Pulse, which talks about different payer and provider webinars, I believe the Pulse comes out weekly for healthcare from Tableau. So if you're not receiving that right now and you want to, let us know. We'll help connect you with the right link. I couldn't find it right away in time to add it to this slide, but it's pretty cool. And when you go to this link, which I actually have all the hyperlinks listed here in the notes. So when I share the slides, you'll see the full path. If the link doesn't work, you'll be able to copy and paste that full path. But it's pretty cool. Everything for 2020 has been recorded. So even if you haven't received the emails to see the webinar live, you can still go view them on demand. So if you're kind of sick of hanging out with family, and even though it's the holiday season, now you have something else you could do. The Tableau new features that are coming soon, this link is really cool, so we thought it was worth sharing. It's out there and available to everyone. It actually is a lot like when they do a release, and you can scroll down and click on the different features to interact with those new features and learn about them. This new features coming soon is set up the same way. So they've already got the feature far enough along that they can share it with you in this coming soon area. They don't necessarily tell us what release or what date it's coming, but it's a mature enough release for them to get excited and share and interact with you. And then, of course, our Chicago Healthcare Tableau user group community site for this group. We do meet quarterly. And what we're currently planning on for next quarter's Tableau user group meeting is governance. And we have someone from Tableau who specializes with this topic, and she's going to do some presenting on governance. And then we've been talking with Parkview Health, who I believe might also be in the audience today. They've got a phenomenal number of dashboards. They've been presenters with us before. The current thought is that they might be presenting the hospital floors that they've developed. It's a map of their hospital floor showing how long it takes nurses to arrive in a room. And they've got some really cool color coding and nice things to help it pop out. All they did was give me a snapshot, a screenshot of it, and I got really excited about it. It looks really awesome. So I think that's gonna, whether they present on that or present on something else that they're excited about, it's always good coming from Parkview Health. And then we really would love to hear what topics you are interested in, whether it makes it in the first quarter or second quarter. We want to make sure that these user group meetings meet your needs, the users. So I don't want to be server heavy. I don't want to be demonstration heavy. If we need to be talking about technical aspects of how to develop something. If we shouldn't be talking about technical aspects and we should be talking about licenses, we want to hear that from you. So tell us what's most meaningful to you right now. And you can do it right now, or you could do it in the chat, or you could send any of us an email or go to the community. Any last minute questions? We have 30 minutes left, and you are welcome to enjoy that 30 minutes for whatever else comes along, or we can stay here and stare at the candle for a little while. What do you need? How can we help you? Aren't we glad 2020 is over with? All right. People are dropping off. Us presenters, we will stay on the line until the last customer drops off. Thank you very much for your time. Kelly, if you haven't already, I think you could stop recording.
There we go.